Hey everyone, thanks for checking out my YouTube channel. In this video, we're going to go over part 2 of a supraspinatus rotator cuff irritation or tendinopathy, that pain across the top and the outside of the shoulder that may radiate down the arm to the elbow, may radiate up to the side of the neck. In this video, we're going to progress to more aggressive or more strenuous exercises to further strengthen the rotator cuff as well as improve your pain. Our first exercise is going to be external rotation of the shoulder. We're going to use a band. You can use a pulley system or just whatever you have. I do like the bands because a lot of times you can fasten these easily to those anchors that goes around the door. I'll put a link in the description for a set of bands. What we want to do first is kind of keep the elbow in by the side. If you have trouble keeping your elbow in, you can take a towel and roll that up and put it underneath the elbow, between the elbow and your side. And you're going to work on initially a very, very light resistance level that makes it pretty easy for you to be able to go all the way out as far as you can and then come back in. This is strengthening the posterior of the rear cuff, so the infraspinatus and the teres minor muscles in the back side of the shoulder. Now these are not the muscles that are causing your pain necessarily. It's limiting your ability to bring your arm out to the side, although they can. But for this video, we're talking about the supraspinatus, which we know performs primarily that movement out to the side like this, or assists with that movement. But we still want to strengthen all the rotator cuff muscles to optimize function of the shoulder. You're going to perform this for 2 to 3 sets of 10 to 12 repetitions, 1 to 2 times a day. Now we're going to perform internal rotations. We went external rotation where we bring our hand out. This one we're going to bring the elbow in again, and we're going to pull the band towards our abdomen. So we're going to pull in like this, 2 to 3 sets of 10 to 12 repetitions, and repeat that a couple times a day. That's going to work on the subscapularis muscle. That's an internal rotator of the shoulder. It's a big muscle. It's much bigger than any of the other 3 rotator cuff muscles. We want to make sure we strengthen that as well. So again, 2 to 3 sets, 10 to 12 repetitions, a couple times a day. Our next exercise using that same band is going to be retraction or a band row. Again, you can use a cable system if you like, just your preference. We're going to pull back, so I'm pulling back, really squeezing my shoulder blade as it comes around on my ribs. Perform this for 2 to 3 sets of 10 to 12 repetitions. Really want to strengthen this area because a lot of times our pec muscles and biceps and front part of our shoulders, our anterior deltoid, becomes very strong and can overpower those muscles that kind of pull us back in this position. So we want to make sure that we focus on strengthening that area to again improve functional use of your upper extremity. Our last exercise is going to be a standing Y. Really I call a partial Y because a lot of times you're not going to go all the way overhead. You're going to use a band, and what you're going to do is put the band underneath your foot or feet, whichever way you need to stabilize it the best, and we're going to bring the band up in this position, almost like we're trying to make the letter Y. Although you can go all the way overhead, but a lot of times people that are having a lot of pain, it's very difficult for them to be able to do. You're going to perform this for 2 to 3 sets of 10 to 12 repetitions. Now, a variation of this, if you can kind of see, I'm going at about a 35-degree angle here, so not straight out to my side and not straight in the front. You can kind of play with that. If you feel better going straight out to the side, you can do that. In fact, some of my patients I'll have do that, just go straight out to the side, and that's fine too. Just whatever feels the best to you. And sometimes that may not feel as comfortable as going a little more forwards, may feel a little bit better. But again, repeat that a couple times a day. That completes part 2 of our supraspinatus irritation program. Just remember, it's normal to have pain increases while you go through the program. Your pain is going to increase, your shoulder may be a little more sore, your symptoms or radiating symptoms may be a little bit more. As long as that goes down within a couple of hours of going through your exercises, that typically is okay. So just be sure and make sure that you're continuing also to do that stretch, that chair stretch where you kind of grab the bottom of the chair and you lean over. You want to make sure and do that stretch just throughout all 3 parts of the program. Thank you so much for watching. I hope this video helps with your shoulder supraspinatus irritation. Be sure and hit that subscribe button so you can stay up to date on all my content.